Dr. Edelman to co-edit this special, these are my disclosures by the way, the special JSCAI issue on the role of AI in cardiovascular interventions, 21 papers, including 6 original contributions, 7 reviews, 4 viewpoints, 1 study design, 2 research letters, a great variety, or a great compilation of the latest in the field, a great manual. Here's a little bit of a walkthrough through the contents, the outline. The first section was on AI, on innovation and governance. I'm going to highlight a few papers among so many excellent published in this special issue. This comes from the Yale group, Dr. Kera's lab, role of AI to help with diagnosis, planning of procedures, and of course interprocedural guidance. As you can see here, AI helps with automatic, personalized, consistent analysis of all kinds of tests involved in interventional cardiology, from EKG, labs, all the way up to imaging. And then, having said that, not only helps with the diagnosis, but also with planning of coronary or structural procedures in a very fast, very accurate, very reproducible, very patient-specific, very individualized approach. Second section of the issue, role of AI in imaging, all kind of imaging. A couple of interesting papers here, among many excellent, to be highlighted today in this session during the interest of time. Role of AI in imaging by Dr. Edelman's group. You see here, echo, MRI, nuclear, CT. Bottom line, the keywords here is that AI adds speed, adds precision, and adds consistency. Now, AI in intracoronary imaging, not only non-invasive imaging. That's from the St. Francis group. You can see here that when we put together imaging with AI, it brings imaging to the next level, imaging plus, helps with automatic segmentation, characterization of the tissue, of the plaque burden, helps with better interpretation, fast interpretation of images. So to Dr. Chemi's point, we don't need anybody to spend any brain cells for this. Let AI do the job for you and make it more streamlined, to make decisions about how you treat the patients. And of course, it helps with adoption of imaging in the cath labs and hopefully with improvement of patient outcomes. Another paper here from a consortium, a group of experts from UK and US, mostly Yale, on this led by Dr. Chemi, showing here that AI can help us to identify the landing zones, proximal distal landing zones, so that we don't need to spend lots of energy and reduce the interoperator variability on where we should land optimally our stents. Another section in the issue is now more hardcore, from diagnosis now to therapy, how AI can help us optimize intracoronary operations. Couple of interesting papers, again, among many interesting papers in this issue. That's from our group, my group, where we highlight that it's not only AI, but it's also simulations, computational simulations, and also augmented reality, and all three together, ACER, as we call them to encompass all of them, can help us with planning of procedures as well as with procedural assistance. You can see here that AI does the cath lab of the hopefully near future, where we can have in real time, I want to highlight this, AI helping us with procedural precision, optimization of our workflow in the cath labs, faster, more relevant decision support, and of course, improved physician and patient safety. Hopefully, down the line, with these approaches, with integration of AI in the cath labs, we can have lower healthcare costs and, of course, improved patient outcomes, which is the holy grail of all of our efforts in medicine. Another interesting paper here, from diagnosis to therapy now, to predict complications using AI of coronary interventions. As you can see here with this tool, this group, it's an original paper, found that with AI we can have a nice prediction of the content-induced nephropathy and bleeds post-PCI. Very, very helpful towards improved patient outcomes and better planning of procedures. And then some other sections, robotics, shock, congenital heart, education and training, talking about shock. That's from Dr. Kapoor's group, where they used machine learning. It's one of the siblings of the, of the components of AI, where integration of clinical, metabolic, hemodynamic data can help us identify the responders to several treatments of cardiogenic shock, including mechanical support, and also predict the risk for mortality and so on. Another interesting paper on congenital heart, that's from the Boston group, from Children's Boston group, where they used this tool to integrate clinical data, laboratory data, and so on, to identify the risk for patients who go through congenital cardiac catheterizations. Very, very interesting approach as well. And then finally, AI in education and training. A couple of papers here. This is very interesting, very intriguing. ChatGPT taking CATSUP, Interventional Cardiology Review Board questions. And you see here, untrained ChatGPT doesn't do very well. But when you train the ChatGPT, it's performing more or less like a test taker, like us. And you can see here for several segments of the CATSUP board questions, the turquoise here is the ChatGPT, the trained one, and the blue is the us. You see that ChatGPT even does better when it comes to procedural technique segments, to basic science, complications, miscellaneous. So again, AI in education and training, and maybe taking the tests down the line. And then finally, virtual reality, a very interesting paper from the Mayo group, where they use virtual reality to help our trainees learn better, greater, faster, understand better the projections in the cath lab in an X-ray free and contact-free, very forgiving environment. Seeing is believing. And then finally, we concluded all these papers with this editorial with Dr. Edelman, where we summarize and highlight that AI is here to stay for the years to come, to help us democratize expertise, not have the expertise restricted to experts, but also be available to the masses, help with planning of procedures, device R&D, faster and more cost and time-effective approval, clearance of devices through FDA, education and training, and of course the future is definitely bright. And a special thank you to the visionary editor of this beautiful journal, Alexandra, with a huge assistance by Dominic. Thank you both. And of course the huge support and alliance here by mentor and friend and co-editor here, Dr. Edelman, of course, to the effortless reviewers who have been working on those papers despite their heavy workload with clinical and other duties. Again, thank you so much for the opportunity. Thank you.